Good morning, students. I hope we are just continuing with our stability study on herbal drugs and drug preparations. In which last class, this is second part, in which we have discussed up to the test schedule for stability of new drugs and how the time point for sampling and what all the environment should be controlled for the stability study, the relative humidity and the temperature maintained should be maintained in the instrument, up to which we have discussed last class. And now we are just continuing it, this according to the long-term climate and the zones. Even in the last slide we have seen about the zones, even how the WHO have given the zones and how to maintain the temperature and humidity in the stability testing for herbal products and as well as herbal materials. So today we are going to see about the factors affecting the stability of herbal medicine. Factors affecting. This we have already seen in the last semester itself regarding the stability study. The same thing can also you can refer. This is just we have gone little more detail with some examples of the test, how to perform that which we have included. Understand? There we have just taken as a stability study along with the patent and we have studied that. Just you can have a reading on that part also. This is almost the standardization and the quality control of herbal drugs is related to what you have studied about the herbal drug technology in 7th semester. So here the factor which we have to remember is drug interaction, deterioration, decomposition during the storage, physical stability, chemical stability, environmental conditions, and variability in the complex mixtures of herbal drug preparations. You know, there are various herbal drug preparations which are having complex mixtures are present. That's why we made that point also as a factor which affecting the stability of herbal medicine. So when you see, again I am repeating for these points to be remembered by the students when they want to write the exam. Always that will be the best thing if you have hints and points by points if you remember. That's why I took long time to prepare these type of slides with the points and to focus on the points to just to listen, and with the vision also will give some remembrance for the students to appear in the examination. That is what my point of view to give these lectures. Because online lecturing is somewhat, it's also we need some practice and to record, but at the same time even the student also for listening they need some exposure, some interest, some interesting color or vision as well as listening should need. So factors affecting the stability of herbal medicines, physical stability, and then comes physical instability is also affecting it as a one factor, chemical instability and environmental condition and variability in the complex mixtures of the formulation of the active markers or active components which is present in the formula or in the formulation, and drug interaction between them if it is a complex mixtures, drug interactions with excipients and also drug-drug interactions and decomposition, deterioration during storage. These are all things which will affect the stability of herbal medicine. Factors affecting the herbal medicines, this is what we have just discussed now with the picture. We are just going to number 1, physical instability. The herbal medicines are usually susceptible to physical instability due to the presence of impurities and reaction with the containers. Containers and closures, we have many materials which are using, which also having some influence or reaction with the component which we have packed in them. And also active principles which we are most important, as we are telling it, active markers or active principles which are present in our formula, which are present in the products, may react with the containers and closures or containers, the material which may react, and sometimes leaching may occur, sometimes deterioration and even incompatibility may also take place. So that is the first one, physical instability. And microbial contamination affects the secondary metabolites and chemical composition of the plants. Microbial contaminations can also affect. And the next one is volatile. Active components of herbal medicine have the problem of volatility and decreasing during storage for the long time. So you can see the volatility will make it decreased because of temperature, because of the climate, and also the component may easily volatile in the product and your complete the stability have been disturbed. So that's why it's also a major factor which will be affecting in volatile principles. And then when you come to chemical instability, the herbal drugs are subjected to degradation during storage by hydrolysis, oxidation, crystallization, emulsion, breakdown by enzymatic deterioration, and a chemical reaction with the additives and excipients which is present in our formula. So you might have come across these things in your formulative when you are studying about the emulsions. And in the emulsions, you know that two immiscible liquids, one is dispersed in other by means of reducing the interfacial tension between them by using an emulsifying agent. Emulsifying agent. So if the emulsifying agent gets deteriorated or gets spoiled by means of the microorganism or temperature, you might have come across the breakdown or cracking of emulsion, and so that you cannot expect an uniform dosage form, and you cannot even expect the therapeutic effect of the particular drug which is shown or prescribed by the manufacturer. So that's what cracking, the picture which I am shown, that is A, B, C, D, the cracking of two immiscible liquids will take place. So temperature, the rate of degradation of most chemical increase with an increased temperature. That is why during preparation of formula of a tropical area, you must consider the herbal medicine consideration, consider, you have to consider the temperature is very important, which will give chemical instability. There are many herbal products, even for external, we are using. And moisture absorbed on the surface of the solid drug will increase the rate of decomposition. Moisture will increase the rate of decomposition. Presence of enzyme in the product also increases the rate of chemical degradation. So, if there is mold, if there is any type of enzymatic degradation is also possible. So, some cases we have to remove the enzymes which is present in them. So, they may also, because of presence of moisture, it may also sometimes because of temperature. That's why they used to keep sometimes low temperatures it should be stored, sometimes hot temperature it has to be stored, sometimes it has to be stored in a normal room temperature without the sunlight also sometimes gives some effect which may have bleached their color, and also they may lose their potency also there. That we'll see, that is what we want to, that all the factors which is affecting. Light, which I was just now telling, many chemicals induced by exposure to the light of high energy, auto-oxidation of volatile oil, why not fixed oil, takes place and the substance become colored and it changes its consistency, it changes its taste, and these all will happen. So they also having an influence in chemical instability. So this is the second one which we discussed. The third one is environmental condition. Environmental conditions such as altitude, temperature, rainfall, and soil condition, as well as different harvesting procedures, how they are having different harvesting procedures, time and method of collection, manufacturing process, even post-harvesting process like drying, extracting, purifying, and genetic variability can create variability in the product quality, stability, and in the concentration of the active constituents. Always we are interested to know about what happened to our active constituents, active principle of a component which we are claiming, label claiming for a particular therapeutic activity. It may lose its therapeutic activity and it may cause sometimes deterioration, and it may cause some incompatibility. It may cause sometimes even adverse effect. So that's why stability study is very, very important. So three we have discussed. One is physical instability, chemical instability, and environmental conditions. And the third one is variability in complex mixture. That means different type of combination of mixtures are there in herbal formulation. We have given in another version. I will show you what we have discussed in last year also. I have taken that slide also. I will just, after finishing this factors affecting, I will show just 2 seconds or 2 minutes. I will show you the slide which I have given in the last class. It is also present in the YouTube. If it is possible, you can just compare and see that how we have and taken little more advanced about the procedure for various stability testing. So herbal formulations are the complex mixtures of different components obtained during the extraction process. Each component has variable shelf life, each component in a mixture of or a complex component formulation. Activity, concentration, and its consistency. activity, concentration and consistency. So it's not an easy to make them to find their self-life. So you see, it creates a problem during storage condition. Determination is not very easy. To determine the stability of final herbal preparation, which contains lots of different combinations based on the activity and stability profile of a single component, because it has many components, so we cannot give a stability report by means of just seeing one component's the stability study. So the fifth one is drug interaction, deterioration, decomposition during storage, even incompatibility. Interaction include with the incompatibility with other components. Moisture content above the critical value and growth of microorganism in natural products can cause the interaction of active components with the packing material. Interaction of active components with the other ingredients of formulation, such as additives, can also cause alteration in the novel drug activity. So we have seen in the last herbal drug technology, different novel drug technology like lysosomes, and we have even transdermal preparations, sustained release preparations are available. And so we have discussed that, and we know we have studied a lot of release study, how they are impregnated with the lipophilic structures and how it can be released even by means of novel drug preparations. So that also we have to have a study over it. And I made it very short, but you can add it what you have studied in your herbal drug technology. So just now, just a minute, let me show you about that which we have discussed in last year. See here, this is what the last year, even I can show you just you can see that is storage condition, drug interaction, containers, factors affecting in stability of herbal drugs, which even I have taken this slide just to show you. This is a topic which we have discussed, that is in the 6th semester, regarding stability testing of herbal drugs and regulatory requirements. There is a chapter which we have seen about this and the problems of physical stability, and even I have given little more detail about certain components of chemical composition of the plant, how the secondary metabolites are affected, and how the environmental factors, conditions are also affecting with them, and even chemical stability we have discussed, and the complex mixture variability in their consistency, and then drug interaction, drug deterioration, decomposition and storage. Even storage I have added how they are having, and even role of markers also I have told in this the last year chapter with 2 slides. So I hope that will be helpful for you to go through slightly. It is also available in the YouTube. So I hope it will be helpful for you to go through and compare, because it is same. So it will be helpful for you to have a discussion with these 2 chapters, and what variations is there, what my teacher have added and what he has deleted. You can write together in your examination point of view. Understand? And then a role of markers. This is also we have discussed in the last sixth semester for herbal drug technology. But I have just made a small little more added in that, some points only, not much. And some examples are also I have added which they have mentioned in the markers, how they are acting over it. So the role of markers is determining the stability of herbal drugs now. And here the markers are chemically known compound which may or may not have a therapeutic effect. They are used to calculate the quantity of herbal medicinal ingredients in herbal medicinal products. It is important to isolate and structurally elucidate chemical defined substance in plant, drugs or drug preparation so that they can be used as markers. If the elucidation is done, they can be used as a markers. They not only help to understand the active principle of herbal drugs, but also can enhance the analytical quality control. So they can also enhance the analytical quality control. Understand? So that is why these markers, if you know the structure, if you elucidate the chemical structure, by means of various methodology which you know that, by means of various instrumental applications starting from UV spectroscopy, IR spectroscopy, NMR spectroscopy, mass spectroscopy, emission spectroscopy, all the spectroscopical studies can also give us help for us elucidation, structural elucidation, and also it can be possible for you to make a marker for your study of stability of various herbal drug technology. Choice of markers. The choice of markers has to be justified. Finding the right markers or finding the right analytical marker is a crucial need for stability testing of herbal medicinal products, HMP, herbal medicinal products. Typical source for finding markers are: number one, where to find this, where to determine, where to make them, to select them, the monograph and the draft which is given by EDQM Farm Europa. UDQM Farm Europa is European Directorate for Quality of Medicine and Healthcare. Experience transfer from other plant constituents is also a typical source of finding markers. Literature, research about known constituents, scientific research, the search of suitable and new marker substance is an important interface between scientific research and the use of the result in herbal medicine product industries routine quality control. So you should know, you should write point by point by means of importance of the markers. The isolation and the structural elucidation of chemically defined substance in a plant drug and or drug preparation not only helps to better understanding of the active principle of herbal medicinal product, it can enhance the analytical quality control. This point we have seen in the previous slide also. I am repeatedly saying this. It is not only true for the study of the active principles. It can enhance its quality, it can enhance the procedure, enhance the researcher to find out various standard analytical quality control for the procedures to identify them. Type of extracts and markers, guidelines, quality given by herbal medicine products or traditional herbal medical products. You can take both in consideration, in which we have taken some example which they have given. I just thought, let me show this too for them and to know the what do you mean by active markers of a plant and what do you mean by active principles of a plant. So standardized extract and you can see specification I have given and the markers, what all, just the two markers. So when a standardized content and tolerance, example content and tolerance, when you want to see, we can go for efficacious constituents such as efficacy of the constituents, efficacious constituents such as silimarians or silimarians, marians, you can silimarians or silimarines, you can say marines, silimarines, you can say, in Silybum marianum. It is the plant Silybum marianum. And quantified defined range, if you want to have a specification of defined range, quantified. An example marker, contribution of therapeutic activity also can be seen. For example, hyperesinus in Hypericum perforatum or perforatum, you can say perforatum. Hyperesinus in, that is the constituents which is present, because we are quantifying defined range. So hyperesins in Hypericum perforatum or perforatum is a species name. So other related to the validated analytical range for others. So you know that in European Union and in the ICH, when you are studying about the standardization guidelines which they have given, they made into three types. That is standard herbal products or herbal materials, quantified herbal products or herbal materials, and others. Do you remember? In that only we have given these specifications. Please just have an idea where we are. And related to that is others, that is a third category related to validate analytic range, analytical markers for analytical purpose such as valeric acid in Valerina officinalis. In Valerina officinalis. Silybum marianum. Silybum marianum. That a plant which we have seen for the standard example. You see what a beautiful flower. And this is a drug which is having more use and it is available in the herbal products. You can see Silimarin isolated compound which is available in the market, and these are the constituents which is present in this plant of Silybum marianum, silibin, isosilibin and silicrystin. So when you see this structure, you have to see what type of structure, what is the basic structure which they have, how many ring structures they are having. All of them they have OH groups, and they have lactone ring with 2 OH groups, and they have aromaticity also even. They have aromaticity, and they have, when you see silicrystin, they have even oxy-methoxy group, and as well as alcoholic groups are there, as we have seen in carbohydrates. So they are but they are not much. Steroidal ring structure is not there. So this can be even present in the form of glycoside linkage, but this is about the secondary metabolite of aglycan part which we have taken. So the structural illustration just I want to show you. So Silimarin is a medicinal use in treatment of chronic long-standing liver disease. You see, it is used for liver disease. Most of the alcoholics, they have cirrhosis in the liver, and the alcoholic fatty liver can be treated by means of this Silimarin. It works by protecting the liver from harmful chemical substances, and also increases the alcohol elimination from the blood and the tissue. It's a very, very, very interesting drug. Even if somebody who is having alcoholics, who is present in our family, or we know friends, can be advised to take this drug for their treatment. You see, this is a beautiful flower which is called St. John's Wort. Name is St. John's Wort, but the botanical name commonly named as, just in the slide we have seen, that is Hypericum perforatum. Hypericum perforatum is a sprawling leafy herb that grows in open, distributed areas throughout much of the world's temperature region. St. Wort preparation is available in the form of capsule unit dosage form, especially in an soft gelatin capsules, because they are liquid phytocaps. They have given in the name. In a small bottle, it can be packed, and it is available by means of the product in the form which I have shown in the picture. And what is its main use? It has a plenty of use, medicinal use. St. John's Wort has been used for hundreds of years in folk medicine, especially for healing wounds. It was used for driving out the inner devil in medieval times. Paracelsus, the toxicology, who was an 16th century philosopher, recommended the herb for hallucination and dragons and healing wounds. So this is what, and works as an antidepressant. Many studies shows that St. John's Wort may help fight mild to release PMS. PMS, that is symptoms, means premenstrual symptom. This is common disease in females, and who have been experienced with these type of issues. That's why I told this plant products is available, which is very, very useful for, and it is used for various ailments. Because of its positive effect on mood, St. John's Wort has proved as a improves mood during menopause stage also. Even in the premenstrual syndrome also it can be used. And also it is more useful drug in the menopause stage in women. And when we talk about the symptoms of PMS, that means symptoms of premenstrual syndrome, what are the symptoms is observed? Especially mood swinging, development of acne, bloating, even GIT issues, and also you can see breast pain or tenderness of breast, depression, tension or anxiety, headache, joint pains, social withdrawal, poor concentration, irritability, increased appetite, excess hunger, and food carvings also can be seen. So these all the symptoms which can seen in PMS, premenstrual syndrome, can be treated, and these symptoms can be observed in menopause time also. In the women can be treated by this St. John's wort. The St. John's wort have especially the main constituents we are talking about. Hybridin, it has many other constituents, but hybridin, they have seen that antiviral effect, it improves immunity, can be used as an anti-inflammatory, it is an antidepressant, just we have discussed, and it is anti-avian influenza. That is actually, it is a very interesting drug which can be used for bird flu. We know that it is a bird flu caused by anti-avian influenza, which is having no medicine till now. So this hypericin which is present in the St. John's wort flowers are used for as an antiviral drug, antiviral medicine in bird flu affected by avian flu virus. And hypericin can be applied in pharmaceutical field. Hypericin can apply to food additives, and hypericin can added directly in the water to prevent the virus. Understand? So this is what it is having: antiviral effect, improves immunity, anti-inflammatory effect, antidepressant effect, anti-avian influenza, bird flu. For infection it can be given for a treatment. Hypericin can be applied for pharmaceutical field in various areas. Hypericin can be applied in feed additives, and hypericin can be added directly in the water to prevent the virus. And this is a beautiful flower plant which we have seen, that is valerian officinalis, a member of Valerinaceae family, is a perennial plant native to Europe and Asia and naturalized in North America. Valeric acid is a colorless, only liquid with an unpleasant odor. This is a simple structure of valeric acid, COOH acid, that is CH3, CH2, 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 COOH. There is a valeric acid which is present in the plant. It is highly corrosive and must be handled very care. Valeric acid is mainly used as a chemical intermediate to manufacture flavors and perfumes, synthetic lubricants, agriculture chemicals, and pharmaceuticals. It is also used as a flavoring aid in foods. Valeric acid is considered safe as a food additive by the World Health organization. So that is the main components which we have to think about. So only few examples, only 3 examples I have given, how they are applicable for this purpose. So you see, anyhow we have to see about the analytical methods. Before that, I want to show you about, to remember where we are, what we are now at present. So these 3 examples which I have given is from this markers, type of extract and markers guidelines quality for herbal medicinal preparation and traditional herbal medicinal preparations or products, you can say. So these 3 we have explained, and then you see, you have to remember about the, before the markers, I would like to say about these factors affecting, especially factors affecting, this is about the last class what we have discussed about all the testings, and then comes towards the stability testings of accelerative real stress testing and intermediate testing, and we showed about a video, and we come across the detail about this accelerated testing, real-time testing, and about the stress testing, and also we had the discussion about retained sample testing, and about the storage conditions which is given by WHO and ICH. Also we had a discussion in last class, and we have seen about the zones which is given, how they have distinguished, how they have distributed by their temperature and humidity, which have to maintained by the researcher, and we have seen the test schedule on in the last class. And today we have seen about the factors affecting, in which physical stability, chemical stability, environmental conditions, and variability in the complex mixture of drug interaction, deterioration, decomposition during storage. So you have to remember physical stability, chemical stability, environmental conditions, and variability in the complex mixtures, and drug interaction, deterioration, decomposition during storage. So when you want to conclude, these all I have explained in detail about the physical instability, chemical instability, and we have seen about the environmental conditions, how they are also influencing this stability study in herbal medicine, and variability of the complex mixtures, and drug interaction, deterioration, decomposition, and duration storage. I did not explain much because we have discussed in herbal drug technology. That too I have shown you in the last year itself. We have discussed, and role of the markers. We have seen what is a marker and what is its role and how to select a marker, and then what is the monograph. From there we have where to find the markers and to select for our stability study, and then how we are guidelines is given for this standard, quantified, and other. We have seen the details about the plant Silybum marianum, which is an example which is given for standard extracts. Quantified extract, we have seen an example of Hypericum perforatum, that also I have given the details, and valeric acid. Valeric acid from Valerinia officinalis, also we have discussed. We have seen this Silurium or Silima, that is, for example, we have seen, 1 minute, I did not say, this is about the Silimarin. Silimarin is what is the effect of for alcoholism and liver damages can be treated, and about the scent woods we have seen, and then we come across about the importance of scent, John's oat, how it is having important in the treatment of premenstrual syndrome, for PMS syndrome in women, and also even menopause also it is possible can have this scent oats and health benefits. Other than this, you can see it's an antiviral drug, and it is specifically it can be given for bird flu, which is the important for the St. John's wort plant flowers, and also valerian is an acid, and a very simple acid, is also a flavoring substance which can be an intermediate substance for a preparation we can be done. And in the next class we will just continue with the analytical methods to determine the stability study of herbal products. Anyhow, thank you. We will just continue this another class. With another class we will just conclude the stability study on herbal products. Thank you.